Hi everyone, and thanks for tuning in to this afternoon's Platinum Physiotherapy Facebook Live presentation. A lot of you have been inquiring today about the kind of things we're going to be talking about relating to stress fractures. So we thank those that have suggested this topic. It's come up a couple of times and we felt it was the right time to talk about it. Hopefully everyone's had a chance to go back and look at some of the previous Facebook Live presentations we've done over the Corona lockdown period. This topic ties in nicely to some of the other ones that you'll have seen about the running injuries that we're currently seeing as a result of the lockdown. Certainly the stress fracture type of injury, a part of that. We talked about the strength work. We've talked about resistance training in the over 50s and the benefits of that. We've talked about people that are getting injured, back pain, neck pain due to working at home habits, and it all ties in. And this is where this S word, as we're calling it today, stress fractures, is a very relevant topic in pre-corona and certainly during the corona period. So we'll just wait for a few of you more to log in, and then I'll go through a little bit about what we're going to talk about today. Obviously, if there's any questions, please type them as we're going along. We'll certainly be able to answer them as we go along, and hopefully just debunk a few of the myths around the S word, as we call it in Platinum, which is the stress fracture, the stress fracture. As a physio of 20 years, the treatment of stress fractures has changed dramatically over the last 20 years, and that's important to people to see the changes, and we'll be talking about that today. So just for those that are logging in now, my name's Neil Sleeman. I'm a physiotherapist based in Durham, in England, and Platinum Physiotherapy, we specialise in sporting type injuries, hence the reason we like the talk about the S word. So let's talk about what we're going to talk about today. We'll talk about the common locations of stress fractures and stress reactions, and you'll hear me starting to bring that other word, stress reactions. Some of you may not have heard of that, but actually stress reactions are a lot more common than stress fractures. But you don't see people posting on Facebook, my foot hurts, I think I've got a stress reaction, when the evidence would say most people are more likely to have a stress reaction in one of the key muscles in the lower leg than a stress fracture. So we're going to talk about stress reaction, stress fracture. What are they? Common locations. We'll talk about some myths. There's about 6 myths I'm going to talk about today, and hopefully it'll help you to understand that they are indeed myths. They're not how we treat these types of injuries. We'll talk about imaging, how important it is imaging if we're going to talk about the stress reaction and the stress fractures. Imaging is a huge part of the correct process, the correct treatment, if indicated, and that's 2 key words, if indicated. Many of these injuries actually will not need imaging due to the response of the way that they're treated these days. So imaging is important. We'll talk about some case studies, which is good to be able to talk to runners about. We're going to talk about the importance of strength work and the importance of not resting, because again, on the forums you'll see I've got a stress fracture in my foot that I've self-diagnosed. I'm going to go and rest, and we're going to talk about why that's not actually the way to go about things these days. Very different these days with how these injuries are treated, and very successfully. Many professional athletes will get these types of injuries and they will come back stronger than ever, and many of them will never re-injure that area if it's treated correctly, which is good. And therefore the preventative strategies, how to prevent having stress fractures, having stress reactions. These kind of things weren't talked about the same 20, 30 years ago. Certainly the start of my career, the strength work was very different. Well, now, even though there will be these injuries that will come along in all the ages and levels of runners, particularly for stress fracture type injuries, they are very preventable in a big way. And the causes can then be sort of nailed out, because everything else being done correctly, you can pick the thing that's not being done correctly, and that's a huge thing. So that's the outline of what we're doing today. So let's talk about the common areas of the stress fractures or the stress reactions in the runner. And many of them will be familiar to you, particularly if you've had them or you've heard about them or you've thought you've had them. The most common would be in the metatarsals. And if I just pick up the foot here, you're going to see my foot, that's the toe bones, those long things there. And the metatarsals will be the most common ones we'd be faced with. If someone came in with a foot pain that was quite sharp, we want to be seeing, is there a chance that this injury could fall into the stress reaction, stress fracture world? That's a key area, and there can be anything from the first toe to the 5th toe, or combinations. Not unusual for more than one toe to have a stress reaction or stress fracture if everything is working against the impact in that particular foot at that time. So you can have multiple stress reactions happening at one time, and sometimes one will cause another. So last year I had a patient started off with a stress fracture in one side of his foot, and then over the course of the year it actually went to other toes because of the way he was walking. Without getting too complicated, it made sense. He was changing the way he was walking all the time. Other bones that people worry about a lot are the tibia and the fibula, the shin bones. Tibia on the inside, fibula on the outside. But again, to jump on and self-diagnose that you've got a stress fracture because you have a tibia pain is not the way to go about it, particularly with with the lack of imaging to show it. Very important. We don't use the word shin splints anymore. Shin splints has been a bad word for many years because it covers too many different conditions. So people might say, is it shin splints or is it a stress fracture? Well, actually there's about 10, 15 shin conditions, and one of them might be a stress fracture, one of them might be a stress reaction, which we'll talk about in a second, and then there's a whole of non-bone related ones. So don't go and self-diagnose a stress fracture of the tibia because you've got shin pain, particularly just because someone you know someone has had it. But that will be another fairly common area. But when I say fairly common, not that common compared to the metatarsals. And then other areas, people might have heard of the calcaneus, the heel bone, that's susceptible to stress reactions and stress fractures. Not as often again, and then occasionally you might get one in the ankle bone, which is the talus, which is rarest sin. So all the ankle and foot bones are at risk of these overuse injuries. In terms of the myths, let's talk about them first. It must be a stress fracture because it hurts to press. I press it, it hurts, it's somewhere down my foot, I'm on a running group, therefore I'm told it must be a stress fracture. Absolutely not. There's a plethora of running conditions that will produce exactly the same pain. If you had a plantar fasciitis type pain, the plantar fascia, you've got to press through that to get to the bone. So if the sharpness of pain is similar, how can one diagnose a stress fracture without an image that possibly could be needed based on palpation alone? There's a whole series of tests that must be done to take us towards that type of injury. So that's myth one. Just because it hurts to press does not mean it's a stress fracture. And I would say the vast majority of foot problems that we see are not stress reactions or stress fractures, and therefore palpation alone is not enough. Myth two, I've run too much, so it must be a stress fracture. Again, myth. All of these overuse conditions, these overuse injuries could be all from the same cause, which might be the running balance versus strength versus other activities. But just because you run a lot doesn't mean it has to be a stress fracture. You can have stress fractures or stress reactions from non-running related activities. There are many workers that have had stress fractures, have the wrong shoes for a number of years, and lo and the process comes on, they have the same running type injury, it just was not running. So just be very wary, just because you run it doesn't mean it has to be a stress fracture type injury. Myth three, the big one. I need to rest for, insert time frame here, to get better. And I saw a funny one this week in a forum, in a running forum. The general rule of thumb this particular post said is that things will get better in 2 days, 2 weeks, or 2 months. And that guides you towards what injury you have. I certainly had to shake my head. Very, very poor advice. I've never heard that it had to be a number 2 and that would decide what injury it is. You have to treat every injury on its own merits. Every person will be different. They will be different strengths. They will have different jobs. They will do different activities, and they'll have different histories. So all of these things come into it. But if you go down the rest route with the myth of resting is going to solve it, if you've done nothing to change anything in the rest period, the return run's always going to be the same, whether it's at 2 days or 2 weeks or 2 months, particularly for this injury. So the strength stuff I'm going to talk about later on, we actually go the other way. We don't rest. If you're not running, which we might call relative rest from running, you're doing more strength work, which might be cycling, which might be swimming, or these days, sport-specific strength work. And often we find that that's the one that gets the people better in the absence of resting, which people take literally, because you'll know within days of starting the correct strength work, are you heading the right direction or you're heading the wrong direction? And we'll talk about the rest and why it's not a good idea further along. Strength work instead of rest work justifies correct imaging, and that's I'm very passionate about. I will know if someone's improving within a couple of days of doing strength work for this type of injury. So don't think that rest, by the definition that it will heal, is correct. If you don't change the cause, how can you expect the weak area to change? So don't just rest because you think it's a stress fracture, and I stress the word think. Myth 4, there's nothing I can do. Again, not true anymore because of the way the research has gone. 20 years ago, we were much less forceful with the strength work with these types of injuries because the research wasn't far enough. But now we know with the athletes getting back quickly after these injuries, there's plenty they can do. In fact, I would suggest the athletes in complete control of these conditions, which is why we see such rapid recoveries, particularly the ones that don't need imaging because the early progress is so good. Therefore, the athlete, the runner that takes control, does the correct strength work with the frequency advised, avoids the risk activity, which could be running at that particular day, but then has that return jog or whatever activity is agreed on the correct day, they then know that they've made a difference. So again, go with the advice. It's the current way to push things along, and that justifies an image or not, which we'll talk about soon. So that's myth 4. Myth 5 is a cheeky one that still pops up. Physios in the past, certainly at the start of my career, had this way of ultrasounding people as a treatment. We don't use ultrasound anymore at Platinum, long gone. And sometimes the ultrasound would cause a sharp pain. Therefore, it had to be a fracture because of the way ultrasound waves first. It's a very sketchy way to diagnose a stress fracture, and one that we personally don't agree with. We don't use ultrasound ourselves as a treatment form, and we don't think it's fair for us to try and use that as a way of diagnosing. It's a clue potentially in the past, but I don't think it would beat a good MRI scan. So don't think if you've had a treatment and a bit of this has caused the pain that it has to be a stress fracture. It's not proven, certainly in 2020. And myth 6, I will make it worse by running. This is a case-by-case thing. I think there's two scenarios. If I'm not suspicious of a particular stress reaction in front of me, I will get the person to do the strength work for the agreed amount of days or whatever to have that test run to see what the % change is. And what it was then is not going to be any worse if they've done the strength work if it's not suspicious. If it's one that I really don't feel comfortable with and I'm thinking this is going to need an image, whether it be an X-ray, an accident, an emergency that day, or an MRI scan in the subsequent days, because of what I need to know from the information, I'm not going to get them to run because I'm not comfortable with it. So you cannot make that myth that if I run it will make it worse. It's not true. In fact, many people make very quick progresses with the strength work, and therefore that moving away, I'm strengthening, I'm not running while I'm strengthening in the early period. You can't just say, I will just make it worse, because it's not true. Sometimes the person needs that run, that first run being pain-free, and the confidence goes from there. So hopefully that helps so far with those myths. And if there's any, please just write them down. I'll try and answer all of the myths that we've got there. Let's talk about the stress reaction versus the stress fracture. It's the same injury, and this is why we call it the S word, the stress word, or even the F word comes up in our clinic, the fracture word. It's a continuum in our eyes. 0, no problems to do with the overuse impact going through a bone, particularly with runners, and 100% the worst stress fracture. Stress reaction at the start, not bone disruption, but there's a little bit of irritation in that bone, a bit inflamed and lots of force with the running, and then it gets a bit worse and a bit worse and a bit worse, and somewhere up here it would be a clinical stress fracture that would show on an X-ray or an MRI scan. The truth is that most stress fractures won't be picked up on a plain film X-ray. And that's why I have to be very careful. We tend to say, I think there could be a stress reaction type injury here. And if the scan showed it was a stress reaction or a stress fracture, in treatment terms, it's not a huge difference. We know there's a problem there if it is imaged. So the vast majority we would see are stress reactions. How early people pick them up is the key. So if you ignore that sharp pain that's always in the middle of your foot somewhere near the third toe, and you keep running on it, and you're not doing strength work, and you're running 5 times a week, and it goes from that pain to that pain to that pain, and up here suddenly you literally can't walk for 2 or 3 days comfortably, then I think we can safely say you've ignored the early signs for a long time. And that's one that we would expect to show on an X-ray if it was a clinical stress fracture, which is a disruption in the bone. Had we had an X-ray in the early part, it probably wouldn't show up. When the bone disruption was not as bad, it might show up in an MRI scan, but actually if you pick it up earlier and you do the strength work, then it never progresses. The bone doesn't get more and more inflamed, and eventually the bone breaks down, which is the principle of a stress fracture. So you've got to remember, when people use the word fracture, sometimes they get confused. You fall on an arm and you fracture your arm. That's a moment in time. You don't know you're about to do that. That's an acute 1-second injury. The person that doesn't pick up those early signals, that foot doesn't feel the same as the other one, you're missing all of these opportunities. So at the early instance that you feel there's a sharp pain under that foot that doesn't feel right, have a look. Do you need to do some strength work? Are you wearing different shoes? Do you need to have an assessment? All these things come into play. Don't think soldering on excuse me, don't think soldering with this pain is the right thing to do, because it's not. We can do so much more these days with strength work and try and work out what that answer is. So that's the clue: stress reaction, stress fracture. Don't get too caught up that everyone has the worst stress fracture, because the vast majority of people do not. So we talk about the imaging side of things, which is important straight away. The X-ray not picking up is sometimes confusing. We often will be forced to send people to the hospital with this kind of injury. And I would say to the patient, I'm not comfortable that there's not a bad stress fracture at play here. The history's, fits, and you just know there's a chance this could come up on an X-ray, which would then trigger treatment, including immobilization, potentially in a boot or plaster in the old days, or however is needed, depending on the doctor that sees that. That X-ray will often come back clear. And it's a sigh of relief on one hand that the fracture is not significant, but don't think for a second that it's not there. And too many people are discharged from A&E settings, which is understandable. X-ray's clear, you're fine. That's not correct. If I was suspicious enough to send someone there, often the palpation will still be as sharp, and you're relieved that it's not come up on an X-ray, but almost all of those people do end up having an MRI scan, which will then show in black and white a problem with the bone. So just be careful. Clear X-ray does not actually rule out a stress fracture, a small stress fracture or a larger stress reaction. Often it makes me more suspicious when the X-ray is clear. But obviously from a timing point of view, it's quicker and easier to get that X-ray in the moment, so that if it is a significant break there, you're in the hospital environment with the orthopedic consultants ready to take over. And this is obviously pre-corona. Don't think that any of that would be as it is right now, but that's the principle of that early imaging, to get that information. So if someone wasn't responding and they were doing the correct strength work that we'll talk about, then it might be we look at an MRI scan, which is absolutely the gold standard, and everyone agrees with that around the world. An MRI will pick up all of these types of injuries, from a fairly early stress reaction where no significant intervention would be needed and the person may be able to run with the strength work required, and then all the way up to the significant fractures, which would easily show on that MRI. So MRI is obviously more expensive, a little bit of a delay into the MRI, and that's why a lot of these injuries don't get rushed to MRI scan, because people often think, if we send all of them to MRI scan, how will this work? The ones that need MRI scanning will always need MRI scanning, because in our view, they'll have done the strength work. It doesn't fit, doesn't sound right, they're not progressing. We need to know why that's not getting better. Okay, so not every stress reaction or stress fracture needs an MRI scan, but those that do end up having them that come through us, you can tell they were always needed, but they've done the strength work to justify having it at the right time, and that saves time and saves money for everyone. So the MRI is a much better definitive way of seeing things, because of all the false negatives that you do get. Images, just quickly, people often still talk about this 2 week. If I leave it 2 weeks and have an X-ray, then the calcification process might be clearer. It's one of those awkward ones. I wouldn't always be in agreement. I think, if someone needs an X-ray, they need an X-ray. If I had a potential stress fracture that was significant in my ankle or foot, I would want it sooner rather than later. I don't need to wait 2 weeks to find that out, to wait for some calcification. Again, the clear X-ray doesn't mean that I haven't got it, but it would hopefully rule out a significant one, which would give me more confidence to strengthen there. So there's patterns that we can help that. Sometimes people aren't in the same amount of pain. The young athletes, particularly the gymnasts that we see in the region, we've picked up dozens of stress fractures and stress reactions, and many of them are not in pain, I would say almost at all, because of the pain that they're used to training with from a conditioning point of view. And it's hard for them sometimes to distinguish between that. So don't always think the pain matches the extent of the injury. For this particular injury, I would say actually very much not. You can often feel something's not right, but it doesn't mean it's 100 out of 10 pain. You've just got to compare to the other leg, see if it feels different, and then go from there. Right. Once it's found, if the imaging is correct, then the pathway is found. If it was a significant one, then immobilization would take place. If it's not, and you're already walking on it and walking fairly pain-free, and it's only painful when you're running, if it was a stress reaction, so that end of the continuum, then you would actually be not advised to often immobilize. Doctors will actually send you away quite happily, but you must strengthen. That's what's going to stop it from coming back. So let's talk about the strengthening. You must strengthen first before we try and get straight back into that running. Why are we strengthening? Because if there's a cause that's a weakness around the bone, the muscles are the best way that you can help yourself to protect the bones that the muscles surround. So it makes perfect sense. The more strength you have, the better you'll be. Then we have to look at running frequency, running shoes, running terrain, all of those things will come into it. So that's really important there. If we talk about a couple of quick case studies just to explain how this pans out, with that positivity that these injuries always get better. You know, we find with the right work. We had one last year, was an endurance athlete doing his first long endurance event, and he had the classic midfoot pain. He was told that it was a stress fracture, but he didn't have any imaging. And there was about 8 weeks to go to this significant long distance event. It was withdrawal time. No treatment as such in terms of strength work, and we were fortunate enough to see this patient. And the tests were not too bad. There was obviously tenderness where it was sore, it was painful, it was potentially in the stress reaction, stress fracture type world, but he had decent strength and he could do a lot of the tests that you wouldn't expect someone with a clear stress fracture that was a bad one to do. And the strength work was a quick responder. The calf raises that I'll show you in the plank position, the cross training on the bike and the swimming, and he was back running within that week. So from that 8-week advice to withdraw, 1 week later with 7 weeks to go, he was back running, and he hadn't run in about 2 months because of the worry that it was a stress fracture being negatively reinforced by what we would call a non-imaged diagnosis. So that was the problem. The diagnosis had gotten away, and he successfully went on to complete that weight-bearing event. And so that's really important, that if you're going to go with that, you know, diagnosis in that sort of advice, we do need that imaging. And even then, with an 8-week turnaround, we've seen people turn around a stress fracture from an MRI scan to marathons well within that 8 weeks, because the strength work they can do while reducing the running can be high, their time can be spent with that, their return run goes well, and then you start to increase the running, and you don't need to go to long distances always before such events. So just be very careful with those case studies, that there's got to be a justification. We always tell people don't withdraw with these events until there's an absolute need, which obviously this year doesn't matter with the corona, but it should be to do with withdrawal dates, refund policies, hotel bookings, travel arrangements. Even the worst stress fracture in the world, I still wouldn't withdraw until that last day before that was a key consideration, because you don't know how much progress you might be able to make with the right strength work. So if that's something that's happened to you in the past and you've withdrawn early on advice from yourself or others, don't. If it doesn't change anything financially, wait until the last possible moment, pick the percent change that you are at that point in time, know how many more weeks there are to go, and you'll be surprised. This is how professional footballers and other athletes do it. They don't pull out of that match until there's an absolute need, because you don't know what the next 2-3 weeks may hold, particularly in a quick responding injury like these. So it's really important. Right, so that's the case studies weight. Now, the next thing we might talk about is the type of strength work. And in terms of running, it's got to be sport specific. So if we talk about the lower body, there's a lot of ankle and foot stuff. I'm going to go and grab my little Swiss ball here. Obviously, we're quite passionate about that. I could do calf raises for a strength exercise, for an ankle or a foot type injury, stress reaction or stress fracture, but I don't run this way. I don't run to the sky. I run forwards. So in my world, a plank calf raise is a good starting point. It can be a double leg calf raise where I'm now going from here to here. Using my core muscles, I could ramp it up a little bit and do a single leg. So now my core muscles are talking to my calf muscles, and I need my calf and foot muscles to be secure, supported. My core's a good helper. If we go to the moving part, because running is obviously a moving exercise, then I would go to the plank on the Swiss ball or even holding a foam roller, and that would be the kind of exercise. If I was suspicious that someone had a stress reaction in the metatarsals, might be barefoot that they do this exercise, or it might be done in shoes depending on the irritability. Foam roller still is a moving object, so I use my core. Why do we do this? Because we're trying to retrain the causes of the injury. If we feel our core doing all of those exercises there, then the load through the foot has to be less by default. Therefore, the brain develops those pathways, and that exercise then allows the next time I run for these muscles to work together. And that's very much an ankle foot exercise. Very good for a lot of conditions, but very successful for that. And that then allows the running technique, confidence, strength all to increase. If people had a cushion or a Bosu ball at home, this is the half disc, there's a lot of good things again, strength-wise. If it's a foot injury in this kind of sphere, then of course single leg standing by itself, even on a cushion, is good. I might choose to try and do a single leg squat. Quite a difficult one when you're looking at the computer. And so lots of key muscles working here, core, glutes, quads, all the way down to the foot. And because it's barefoot, I've got lots of feedback going through the foot there. Again, you can do that on a cushion. So just two simple examples of exercise we would put in the hourly exercise regime. Quite low level, quite easy to do in a household, particularly at this time. And for people that have running injuries, you can see that frequency is the key. The more often you do that strength work, you can see how you feel when you go for that run, and that gives you a bit of feedback as to how quickly you can get back running normally. So it's little and often that's the key. Those exercises accelerate the healing. So when people say, how long will this take to get better? In the imaged stress fracture that was required, you can have a bit of a ballpark guess as to the bony healing time based on the fracture. And that's something that would change. I wouldn't like to put a figure. Often people say 4 to 6 weeks, but I think it's not fair because everyone is different. In the one that wasn't imaged, or the image didn't show anything, the healing time is very much up to you. You accelerate the healing time by the amount of strength work you do. And then you pick that run day with or without the physio's involvement to agree, and you know how much percentage. 30, 40% better, go and do some more strength work. Then leave it 3 or 4 days. 70 or 80% better on that first run, I'd be running 2 days later. I would go do some strength work and I would go again. And as long as I'm getting better and better, then I'm heading in the right direction and the strength work would change. So then suddenly the plank calf raises might be different. I might move away from the more sort of static ones to go to some hopping on a cushion. Because as an exercise, hopping with good control is an exercise we need. A lot of people say, well, that'll cause my stress fracture. But not if you've improved 90% and that exercise is pain-free. We would say the opposite. You want to bring in that work to build up these key muscles. So muscles further up is the other part of the strength work. I'll show you some of the other ones that we often use at Sports Fit, as you know. Things like the speed skaters. So now we've got all the key muscles working, glutes, quads, calves, everything working together. We have the jumping lunges, again, coming back from a stress reaction or stress fracture, one of the better muscles. So better exercises is these things. And you're retraining all of the key muscle groups to prevent this type of overuse injury. The stronger you get, the less chance of the overuse injury from the running come back. We often find people's performance improves coming out of stress reactions and stress fractures because the strength work they do when they have this injury, through necessity, I add, it's not nice asking people to do those things hourly. It allows them to build muscles they haven't done before. Through choice, hard to say. Maybe they just like running, and runners know that. So when you get strong and suddenly you feel like you're not only injury-free, but you're faster, you should have a look what's changed. And usually the answer is, I did strength work for my injury. My park run time seems to have come down. We tend to find in that 4 to 5 week period post-stress reaction improvement, people's park run times come down because they get their fitness back in the first month. Their running efficiency is improving, but they're stronger in the muscles. So therefore the stride length could be slightly more, and at the same cadence, the park run time comes down. It's quite an easy equation. If your muscle strength is better, then your park run time would normally come down quite easily over that 5K. So you want to continue that strength work, and then it would become part of your running week. And then it makes it easy to work out how to avoid the common problem. People get rid of the pain, take away the strength work, running frequency goes up, strength work goes down, and lo and behold, you come back to square one with a future overuse injury. So don't let the strength you've built up disappear, whether it's done at home, at the gym, programs, swimming, cycling. Don't stop that as a runner. That's important. Right, foam roller, lower leg, absolutely. So if I had a stress fracture in the foot and I've been fortunate never to have this type of injury, I know I would want my calves to be nice and loose. So yes, it doesn't really matter whether this is heading towards imaging or not. I could have any injury in my foot. The foam rolling of the calf is not going to negatively impact that foot problem, whether it be a stress reaction or stress fracture. Even if I was going to be heading to a scan, whether it be X-ray or an MRI, I want my calves to be as loose as possible. So don't neglect the foam roller. Yes, if you had a shin problem and I was a bit suspicious of a fibula, I certainly wouldn't put you in foam rolling the outside of those muscles on the perineals there. But I think at that point in time, the foam roller would be the least of our worries. We would certainly be looking for an image on the X-ray. So if you have these type of symptoms, the early interventions, even before you see someone, is get into the foam roller and find those knots properly. It's all about technique. Obviously, those that have done our foam roller class know we're pedantic. You must find those deep knots. Once they're loose, your pain will either get better or it will stay the same. And then you'll know how much of this is likely to be a bony or non-bony cause. So foam roll like mad if you've got these injuries. Strengthen and ask us for advice. We can give you the specific exercises. And icing. Haven't talked about icing, but it is important for these injuries. If it's getting worse and you know the pain's really sore to the touch and weight bearing, you've got nothing to lose by icing. It can only help any inflammation that is there, and it may well be the key, that early icing, to bring the inflammation down, allow you to do the strength work to get that early improvement that might avoid the need for an X-ray. So if you are suffering and you haven't iced it and you haven't foam rolled and you haven't done any strength work, you're really not doing everything you can to get a picture of how bad this is. Sitting there and resting with elevated and putting some cold on it once a day is not enough. We say ice non-stop. It does work. You just keep on rotating those frozen peas, you keep on using the roller, and you keep on doing whatever strength work is prescribed for you at the time. So I think that's most of the things that I wanted to talk about there. I hope that we've had a good amount of information there. We could talk about this topic all day. So what we'll do, if anyone's got any comments, please just type them in now. I think there was one other I was going to answer that was messaged before. Yeah, so swimming, obviously, with the corona situation is a bit awkward, but the hydrotherapy, exercising in the pool, has always been very well used and should be used for stress fractures. Obviously, leisure centres are closed for some time. Open water, obviously, is starting to open for the more confident swimmers. Certainly, the lower leg responds brilliantly. We've had people doing the aqua jogging even when they've been immobilized in the boot, and that works very well to keep the key muscles moving. So certainly in the water, we would advise all these injuries to do very well, and cycling, depending on the location of the stress reaction and stress fracture, cycling is an excellent way to keep leg strength. But again, it depends at what stage. If you're just being put in a boot for a shin stress fracture, we wouldn't be getting you on a bike outside for risk of falling, but there's a point in time where you could use the exercise bike safely there. Now, if there's any questions there, we try and keep it under 30 minutes, so we've just gone slightly over there. Hopefully you've learned a lot. Keep your strength work up. People are asking about the video link classes. Yes, we've got nearly 50 video link classes going on at the moment. Just have a look at the page. Many of them are strength and conditioning, such as the sports fit ones that I showed you some exercise. The Swiss ball classes, about 25 of those weekly. We've got the foam roller class that you just do as a one-off to learn how to use the foam roller properly. And then we do have the lower limb classes, which are more specific for these types of injuries for athletes and non-athletes alike. So it's quite a variety of classes there. We encourage you to trial a class always first before you commit to doing a program of them. And at the moment, we've got the classes running 7 days a week, all times of the day, mornings, afternoons, and evenings, through a video link situation. But obviously, I would be able to see you if it was one of those classes. So if you want to get any more information about anything we've said today, please contact us. Drop us a message or drop us an email. Probably the messenger on the Platinum Facebook page is the quickest. We're all working remotely from home, as you can see. And in the meantime, happy running. Hope you enjoy the nice weather out there, and keep the ideas coming for the next Facebook Live presentation. Thanks then.